So we made it back from Italy, and we both got sick, and you got really sick, Jessica. I'm so sorry. I'm going to obviously have to do both sides of Health in 2.0 today because you're barely able to. The antibiotics have kicked in enough for you to get out of bed, but it's not good. We are trying to catch up from being on the road and ill, and my God, where have we been? Edition. It's the November 24th edition of Health in 2.0. So Jessica, can you talk? Are you alive?
You're so mean to me.
I'm not mean to you.
Why would you make me do this?
You've been unbelievably super sick for like.
Yeah, I know. And so why am I here right now talking to you?
The show must go on, and I can be replaced, but you can't be. So
you're like, I need attention. I need you to pull it together. Take some Tylenol.
Just take some antibiotics and some Tylenol. Eventually, you'll get off the couch and you'll make it. I'm sorry. We'll be sending you more care packages. I'm so sorry. Anybody else to say
care packages? More care packages? There wasn't even one care package sent.
Okay, there was emotional care packages.
Oh, was it? I didn't get it. Try again.
I'll try again.
Fax it this time.
Well, you did get a big care package, right? Veritas and Elliott Capital Management, the people who tossed Jonathan Bush out of Athena Health, they paid the stock market, price, which was like $5.5 billion, and they had another thing. They merged another company, which was the GE company, which put another $1 billion into it. So they had a $6 billion thing 3 years ago when that all fell apart. They just sold it this week to another company for $17 billion, which by my math is three times for Athena Health, 3 times what it was worth 3 years ago, when Allscripts and Cerner, which are the comparable competitors, are worth basically the same they were 3 years ago. So very strange to me.
17 billion, which is crazy to me.
I mean, and that at a time when the last couple of weeks and even today have been like the worst time for digital health on the stock market you've ever seen, right? Teladoc leading the market down very fast. Yes, I still own far too much. Oh, very sad.
Teladoc, what has happened to you?
They had an investor day, and since then they've fallen 20%. I think showing how great it was going to be for the investors. They didn't obviously.
Yeah, 2 days after that, I sat in line in the virtual waiting room for 2 hours for a visit to happen to me.
The demand is pretty high. Clearly, they're not satisfying it as well, so we'll see.
Clearly.
It's not like they have a lack of patience to be waiting 2 hours. Oh.
No, but at least I could wait from bed.
Yeah, better than having to go out and get sick. All right. Well, we're going to catch up on a bunch of deals. Okay, Jessica, I've got my clock. Hopefully, I can make it work.
We'll see.
Didn't work. And we are going to
go.
The
only thing that can make me feel better, which is stuffing money. Papa gets 150 million, brings their total up to 240 million. Oh my God, Matthew Holt.
I love it, right? You're sending people around it's sending people around to hang out with Medicare Advantage recipients.
Love it.
Seems to, and they just hired Emily Hackle to go with Liz DeMattis on the marketing team. So we love them to death. Just seems to me that that's a hell of a valuation for what's basically a staffing agency. So,
smart though.
Smart guys, great company. I hope it's worth it.
All right. MSK continues to become unhinged. Sword raises 163 million Series D with, my favorite thing, a secondary of 26 million. Who knows what that is? Bringing their total up to 320, their valuation to 2 billion, and they have a splashy little animated video that tells you all about it floating around Twitter.
This is the rise of the Portuguese. You thought it was just Cristiano Ronaldo and the soccer players, but no. Portuguese-based MSK company comes good. The other one, Kai, is the German one. Hinge is the British one. Is there an American MSK company? Or are we being dominated by foreigners again? If I was to say it's insane, I think I would be, judging the national mood.
So much room there. Trueveta gets 105 million, brings their total up to 200 million. What do they do?
This is the data play from all the hospitals, about 20 hospital systems that have come together to integrate their data with each other, do anonymized data. They put out some random study about COVID vaccines. It's another data play, a little bit to compete with Clarify and Komodo and those guys.
All right, what about Trusted Health? They get 149 million, brings your total up to 175.
Yeah, this is a nursing recruiting platform, which is clearly a massive problem at the moment as the Great Resignation goes on. There's another one called Incredible Health, which hasn't raised that much money yet, but it's backed by AZ16. Cool, interesting, maybe.
Okay, and then there's
you got it just as the buzzer went. So keep going.
Maybe it's the cold medicine. Maybe it's my lack of understanding how to pronounce things. But this startup is Ieso. Who knows? 57 million mental health space.
As we were
Blowing
discussing.
my mind for a loop here.
Well, I mean, mental health's interesting, right? Because we have a bit of scandal, right? Spring Health apparently making employees work 60 hours a week.
Scandal. How dare they make people work 60 hours a week? What is the matter?
Startups, far too much. They should be lolling around, lying on couches, eating bonbons, drinking kombucha, and enjoying themselves, not having to work at all.
Terrible.
So Ieso is a British company which does a lot of deals with the NHS. Their alleged edge is that they have collected all the data from the text. It's a text chat thing with your therapist.
Ooh.
Collected so much data, and they know so much about patients and therapists that they're converting it all into a bot. So you may know that bot, Wobot, which
yes.
Monique Levy, we met in Italy where we were, and I am a minor investor in. Talks to you about this, that, and the other, and that's all AI. And Lark has something similar, but not on the mental health side. I think they do something on the mental health side.
X2 AI has something too, I think, in this.
I can't remember. A whole bunch of
Tess is her name.
So their idea is that their bot is better than your bot or Wobot or anybody's bot, because it's going to be what I don't know is how much of their current business is therapists texting, which is obviously a limited resource, versus the bot, which is presumably an unlimited resource. And I assume that's the direction they're heading. And for that amount of money, they must be thinking about coming this side of the Atlantic, because the NHS is only going to pay you so much. And I always thought the British, traditionally we're very, very open and about our mental health and our emotions.
Whatever. You stuff it and stiff upper lip it, man.
My entire life was laughing about what people in Beverly Hills going to their therapist. We would never do that because we're British, and maybe the young Brits are all different. There has actually been in the UK a little bit of discussion amongst soccer players, who are the barometer of stars there, about their mental health issues. And they haven't quite got to the Michael Phelps, Simone Biles thing. By the way, now we're way off the 2 minutes and we're done, but Michael Phelps
never stopped you before.
Okay. We've got some skip. Do you want to talk about Talkspace?
Well, yeah, let's talk about Talkspace.
So Michael Phelps.
Oh my God, there's so much scandal. I love the fact that there's scandal. The 60-hour work week is not really scandalous, but good effort was made to make it seem so.
So while we were away, Talkspace had terrible third quarter results. They were no growth at all. And the founder and his wife, who were the sort of founding team, were exited stage left. And at the same time, there was an offsite. And the COO, who had come from Teladoc, where he had, what had he done?
Scandal.
Go on, tell me.
Wasn't he having an affair with somebody and then gave her insider trading tips?
And then she got fired.
Uh-huh.
Apparently, someone on Twitter tells me it's called Ieso rhymes with miso.
Where was this like 5 minutes ago? Ieso rhymes with miso.
Somebody tweeted me 1 minute ago. I went over to look at the Teladoc guy and instead I got that.
Look at this real-time information coming in.
Real-time information.
Folks, real-time information coming in here as we discuss the gossip from last week. Okay, go on now.
The gossip from last week, right, is that the CEO of Teladoc, whose name I can't remember, I'm just going to look up.
It was like Hassan Pfeffer or something like that. He had like
a Mark Hirschhorn. He was the guy having an affair.
That's it.
He got to keep his job at Teladoc, right?
Of course he did.
Whereas, like, not only that the girl who's having an affair with, or the woman who's having an affair with, get fired.
I hope she got out of that T-Doc stock before this last week.
Well, her insider tips weren't as good because he hasn't been there since February last year.
Probably been better off on her own.
Anyway, there was a retreat last week, an offsite retreat.
So wait, he's at Talkspace now at this point.
They fire the Franks, Oren Frank and Ronnie Frank, who were the husband and wife team who set it up. They fired them. They're gone. They have a retreat. I'm not sure whether the retreat happened before or after the firing. At the retreat, he did something bad enough. The retreat was only last week. He did something bad enough that he got fired immediately. So I don't know what he did at the retreat, but it wasn't good. It wasn't like we're having investigation. It was like he's gone. So yeah, not good.
Number one, you are the worst at telling gossipy stories. Number two, let's speculate wildly about what could have happened at that offsite. More insider trading tips. He's like, trade this Talkspace stock. Get out now. Buy T-Doc on the low.
Maybe he stood up and said, everyone should sell the stock. And the board said, that's no good. But it might have been that, he tried to start an affair and didn't.
For money or for love? Let's find out.
In public? Who the hell knows? We can gossip. All right. We have a guest, so we should go out of here.
We should. Okay. All right. For more hard-hitting gossip, please follow along on Twitter. He's over there at Bolty Boy, a one-man rumor mill. And hey, a special guest.
Hi, everyone. How are you?
Oh, we knew this was going to happen. Special guest. What's your name?
I'm Kate O'Malley. It's nice to meet you.
Nice to meet you too. You are on Health in 2.0. Surprise. So let me get out of it so that I can leave and you can continue to have your next meeting. Okay. Where was I? I am on Twitter at Jess Tommaso. You can tweet at me if you'd like to become a guest star on Health in 2.0 and just have this happen to you. Oh, look, someone else. Let's see who this is.
Hi, Selena here.
Hi, Selena.
The whole team come.
Health in 2.0. Oh my God, are there more people coming?
I said there's more people coming. You should get us out.
Great. Let me just continue to try to get out of this. Hang tight. You can make sure that you don't miss an episode, including one that you find yourself in all of a sudden by subscribing to our email newsletter over there at thehealthcareblog.com. And Mr. Holt and I will be back with more fundraising deals and some better cold medicine soon. We'll see you guys later. Thank you. And to our special guests, thank you for joining us.